Hey everyone, it's Donna from the Health Insurance Insights Network. Today I am here to help you put the puzzle pieces together for your coverage, okay? Um, Today I want to talk about premiums. They are rising everywhere. Over 22 million Americans are at risk of facing higher premiums or losing coverage altogether if the subsidies aren't extended. I want to talk about a little bit about what's at risk and how you can still save money. Try to find a little bit of hope in all of this. I don't really want to get into the politics of it all. That's just not my thing. Um, I'm not going to pretend that I agree with the subsidies not being extended. I don't. Um, there's, they were there for a reason. They were there to help, and you know, I do feel like they should be extended. But that is not my purpose. I'm just trying to figure out what we can do to move forward. All right. So premiums generally rise for all of us every year, as do our deductibles and our out of pocket maxes, right? This year is a little bit different because of these subsidies not being extended. So many families with marketplace plans, I've been seeing many posts across social media. Um, the subsidies that kept these affordable may be disappearing. That means that many of you are facing much higher premiums or may even lose your health care altogether if the new rates just become too much to manage. My understanding is that the rates are three times the 2025 rates, which is absolutely absurd, tad bit ridiculous because that is a mortgage payment. And when budgets are already tight, we're shopping for grocery. That is quite expensive right now. Then that kind of shift hits hard, right? So when these premiums do spike, I know that you are making tough decisions. I, personally, I am still employed with a company, so I have employer sponsored insurance. But I do not feel that I am immune to this, as if this is impacting the rest of you this year, it will impact the rest of us, I'm pretty sure, in the following year. So please pay attention to what the person next to you is experiencing. Just because it's not happening to you right now doesn't mean that it won't. Okay. Um, Things that I really don't want you to do is delay your care and skip medications. And I really don't want you to choose the cheapest plan unless you understand what you're doing. Because there will be trade offs. And then I really hope that you all are able to figure it out and not lose coverage completely. Because this not only puts your health at risk, it also puts your finances at risk. And, I know you're probably looking at this like, hey, I can't afford $2,500 a month. In addition to my current expenses, let's try to explore some options. All right. So if your coverage disappears or the premium just jumps beyond your budget and you're not stuck, I don't want you to feel like you're completely stuck. I do want you to try to apply for some things that you may have never really applied for before, but I do want you to try anyway. Um, if if Medicaid is an option, I do want you to try that at least for your children, if you have children. Um, Maybe try individual policies in lieu of marketplace alternatives, so that you can have some sort of coverage. And if you don't have an employer sponsor, if your spouse maybe has an employer sponsored plan, maybe try to put your family on that plan, um, which you should probably be doing that anyway if they have an employer sponsored plan. Um, it's shaping up for 2026 to be a tough year. Just ways that you can protect yourself. If you still have coverage, definitely use your preventative care benefits. I just need you all to realize that you are paying for those benefits, whether you use them or not. I have people that call our practice all the time and they're rescheduling appointments off to the next year. But, you know, you're going to pay for these services whether you use them in 25 or 26. You may as well try to get them done in 25 so you can get them done again in 26. You're paying for it. You're wasting money that way. Make sure you're reviewing your benefits, especially your labs, your imaging. If you have telehealth visits, specialist visits, make sure you're reviewing to see what your responsibility is going to be. Um, I want you to check on medication savings programs. Especially if you are on maintenance medication, you may be able to find programs that will help you get that medication at a very low cost or no cost at all. All right. So don't pay full price if you don't have to. I want you to shop strategically this open enrollment season. Um, don't just keep what you had last year. Actually compare it to multiple plans. I want you to consider your doctors, your medications, your needs. These are small steps that can save you hundreds, even thousands of dollars. Very, very important for you, especially with everything that's going on um, in healthcare right now. So, yes, premiums are rising. Yes, subsidies may disappear, but at the end of the day, you do not have to do this alone. We're all going to walk through this together. I will walk through every option, every scenario I can possibly figure out on my YouTube channel. That is the Health Insurance Insights Network at Donna Lee Insights. Come on over there and let's figure out ways to protect your health and your wallet together. See you soon.